so my name's Ashley. We're going to be doing a full assessment today. Start off her skin. Her skin is warm, dry, and intact without any bruises, rashes, edema, lesions, nevi, or scarring. Her skin turgor is appropriate, and her skin color is expected for her ethnicity. I'm now assessing the head. The hair appears to be symmetric, normocephalic, and midline. Her scalp with tenderness, so her scalp's mobile, intact, and no tenderness noted. Her hair color is a smooth blonde color, and her hair distribution is normal and even. And then now we'll do her temporal arteries, their tenderness. So no temporal artery tenderness noted. Now we're going to do your lymph nodes, preauricle, postaurical, anterior cervical, posterior cervical, supraclavicular, occipital, submandibular, submental. No lymphadenopathy noted. We're now going to assess her. Now we're going to assess her nose. Her nose is straight and midline, and now we're going to assess her nasal patency and cranial nerve 1, which is going to be the olfactory nerve. So I'm going to have you close one nostril. There you go. And tell me, take a deep breath in and out through it, and now tell me when you can smell alcohol. Okay, now on the other side, deep breath in and out to check nasal patency. Now. Okay, so cranial nerve 1, the olfactory nerve is intact. We'll now assess cranial nerve 5, the trigeminal nerve. I'm going to have you, we'll palpate the masseter muscle, open and close your mouth, and now clench your jaw. Cranial nerve 5, the trigeminal nerve is intact. Cranial nerve 7, the facial nerve is next. I think tenderness when I did that. So the TMJ, the temporal mandibular joint, had no crepitus, subluxation, or tenderness. Cranial nerve 7 is next, so we're going to have you smile, frown, pucker out your, there you go, puff out your cheeks, raise your eyebrows. Cranial nerve 7, the facial nerve is intact because all facial features were symmetric. Now we are going to assess her ears. Her ears appear to be symmetric bilaterally without any deformities. I'm palpating the tragus and the pinna, any tenderness, so no masses or tenderness noted. I'm now assessing the auditory canal and the tympanic membrane. Any tenderness as I'm doing this. Alright, so no signs or symptoms of an infection were noted. I will now assess her hearing, which is cranial nerve 8, the auditory nerve. People is equally, no lateralization was reported, and that's the Weber test. Will now do the whisper test, and we'll have you occlude one ear and I'll whisper in the other. Apple. Okay, and then apple. So she passes the whisper test because she identified both words correctly. Now we'll do the Ren test. Tell me when you can no longer feel this.
Now. Now.
Okay.
Now. Now.
Okay, so air conduction was longer than bone conduction, indicating she passes the Ren test. We'll now do the eyes. Her palpable fissures are symmetric bilaterally. Her eyelashes extend beyond the eye. Her eyebrows extend beyond the eye. Her eyelashes extend away from the eye. I'm now going to look at her conjunctiva and sclera. Sclera is white, conjunctiva is pink. No discharge or lesions noted. We're now assessing cranial nerve 2 with gross visual acuity and with the Snellen eye chart and central peripheral vision. I'm going to have you cover up one eye than the other and then read the small sign you can read.
D-E-F-P-O-T-E-C. D-E-F-P-O-T-E-C.
So 20/20 vision. So now we will do the confrontation test. I'm going to have you cover one eye and just use your peripheral vision. Tell me on your fingers.
2, 1, 2.
Okay, now the other eye.
1, 2. 1, 2.
Alright, so she passes the confrontation test at cranial nerve 2. The optic nerve is intact. On now says cranial nerve 3, 4, and 6, and that's the oculomotor nerve, the trochlear nerve, and the abducens nerve by assessing her ocular muscle, extraocular muscle. So follow this with your eyes. So she has a conjugate gaze throughout the 6 cardinal fields of gaze, indicating that cranial nerve 3, 4, and 6 are intact. Next, we will do pupillary response to light, accommodation convergence to further assess cranial nerve 3, the ocular motor nerve. This is pupillary response to light, and her pupils constrict consensually and directly. And now I'll have you look at this, now look at the wall, and look back to this. So her pupils constrict when focusing, so she has appropriate accommodation. Now watch this with your eyes. she showed appropriate convergence. Now we will be assessing the mouth. Her lips are pink and symmetric. One last thing, the red reflex with the eyes. Okay, and the other eye. Alright, so red reflex was seen, and her fundus was free of any lesions and normal in appearance. Now I'll assess the lips and the mouth. The lips are pink and symmetric without any swelling. I'll look inside the mouth now. Her teeth are aligned without any dental decay or caries. And then I would usually use a tongue depressor at this point. Now move your tongue side to side. Good job. So her posterior pharynx, her palate, the floor of her mouth, her buccal mucosa, and gums were all pink, smooth, and moist. The tongue was pink and moist and midline without any swelling. Her soft palate rose symmetrically in the uvula state midline with phonation indicating cranial nerve 9, which is the glossopharyngeal nerve, and the cranial nerve 10, the vagus nerve, were intact, and then her tongue moves side to side with ease without any fasciculations, indicating cranial nerve 12. The cranial nerve 12, the hypoglossal nerve, is intact. We will now assess her neck. I'm palpating the trachea and its midline, and I'm assessing her thyroid, and it's smooth without any fibrotic. It's not fibrotic. I'll now assess the carotid arteries. I'm going to palpate them. Okay, and then I'm going to auscultate them for bruise with the veil, and no bruise are noted. I am now going to assess her frontal maxillary sinuses. No masses or tenderness noted. And next we will be doing the chest. So anterior and posterior chest wall are symmetric without any deformities. There's no signs or symptoms of respiratory distress. And that there's no cyanosis, retractions, accessory muscle use, nasal flaring, tachypnea, or tripoding noted. We are going to now do chest expansion. I'm going to take a deep breath in and out. Okay, in and out. Okay, so symmetric chest expansion was noted. We're now going to do tactile firmitus. We'll start in the front. Every time I put my hand, say 99.
99, 99, 99,
Okay, now in the back.
99, 99, 99.
Okay, so vibrations were felt equally throughout. I'm now going to auscultate. But first I'm going to percuss. Okay, and her percussion was resonance to percussion throughout all lung fields, and now I'm going to auscultate. Take a deep breath in and out every time. Oh, that's okay. Okay, and then okay. So her low sounds were clear bilaterally auscultation without use for adventitious breath sounds. We are now going to do tactile firmitus. And every time you feel my hands, just say the word 99.
99, 99, 99, 99.
So vibrations felt equally throughout. And then next we are going to do assess for consolidation. Every time you want to assess the scope, just say the word 9, or whisper the word 99, which is whisper patrollically. Okay, and then bronchophony, just say the word 99.
99, 99, 99, 99, 99, 99.
Okay, and then say the letter E, which is agophony.
E, 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 E.
Okay, so no signs of consolidation were noted. We're now going to assess the heart. And we're going to also do the aorta, pulmonic, Erb's point, tricuspid, mitral. Okay, now it's the veil, aortic, pulmonic, Erb's point, tricuspid, mitral. And now I will locate the point of maximal intensity, and it's the 5th intercostal space, left mid-clavicular border. And now I'll auscultate over that point for an apical pulse, which I would auscultate for a whole minute. Okay, and her pulse is 65 beats per minute with regular rate and rhythm. I'm now going to have you lay back, and we are going to auscultate again over the heart, aortic, pulmonic, Erb's point, tricuspid, mitral. Now with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. S1 and S2 were heard every time I've auscultated over her heart for her heart sounds, and no abnormal heart sounds or murmurs were noted. I will now be inspecting for any heaves or lifts, and no heaves or lifts are noted. I'll now palpate for thrills, aortic, pulmonic, Erb's point, tricuspid, mitral. No thrills are palpable. We will now be assessing her jugular vein distension. If I've got the head elevated 30 to 45 degrees, I'm going to have you turn right, now left. No jugular vein distension or jugular pulsations are noted. For the abdomen, it's smooth, flat, and symmetric. And now I'm going to auscultate for bowel sounds. Okay, so she's normal active bowel sounds. I'm now going to auscultate for bruise over the aorta, the renal arteries, and then the iliac arteries, and now the femoral arteries. Okay, so no bruise were noted. I'm now going to percuss all 4 quadrants, and her bowel sounds were normal active. With percussion, I heard mainly timpani over all 4 quadrants with some dullness over the solid organs. I'm now going to be palpating for masses or tenderness. In the leftover quadrant, I'm palpating for the spleen, which is non-palpable. And now in the right upper quadrant, the liver. She takes a deep breath in and out. Any tenderness, so no masses or tenderness is noted. I'm now going to be assessing for CVA tenderness. I'm going to have you sit up. Okay. Any pain? Okay, so no CVA tenderness was noted. I'm now going to have you sit up here. We're going to start on the joints. So to start with, we're going to take a look at the fingers, the hands, the wrist, elbows, shoulders, hips, knees, ankles, and then her feet, or her toes. So no redness, swelling, nodules, deformities, tenderness, or crepitus noted, and all joints were symmetric bilaterally. Now we're going to assess her fingers. So capital is less than 3 seconds, and her radial pulse is 2+ bilaterally. And now I'm going to do her range of motion of her fingers. So flexion, extension, hyperextension, abduction, adduction, thumb opposition. Next, we're going to do the wrist. So flexion, extension, hyperextension, ulnar deviation, radial deviation, rotation. And now we're going to have you squeeze my fingers. So strength of the hands is 5 out of 5. I'm now going to do your elbow. So flexion, extension, hyperextension, and then push against my hands. There you go. Now pull against. There you go. So the biceps and triceps strength is 5 out of 5. We'll now do the shoulders. So flexion, extension, hyperextension, abduction, and adduction, internal rotation, external rotation, circumduction. And then I'm going to have you push out against my hands. Now I'll try to bring it back in. Okay, and then straight against my shoulder. There you go. So strength of shoulders is 5 out of 5. Cranial nerve 11, the accessory nerve is intact. We will now do the range of motion of the toes. I'm going to have you point your toes down, flexion, bring it back up, extension, hyperextension is up, abduction, adduction, capillary refill, toes is less than 3 seconds, dorsalis pedis and posterior tibialis is 2+ and equal bilaterally, cap refill is less than 3 seconds, and then we'll do the ankle next. So plantar flexion is down, up, and point up is dorsiflexion, inversion, eversion, and rotation. And then push against my hands, pull up against my hands. So strength for the ankles is 5 out of 5. We'll now do the knees. So we will do, we'll do the strength for the knees. It's okay. Sorry. So push against my hands, push against, there you go. So strength of the knees is 5 out of 5. Now we'll do your hips, the strength for your hips. And so I'm going to have you bring this leg out away from your body and push against my hand. Now try to bring it back in. Okay, now with the other leg, try to bring it out away, and now push against my hand. So that was abduction away, adduction back in. Strength of the hips was 5 out of 5, so I'm going to have you sit up. And then we're going to stand in front of the camera and do your hip range of motion to finish that out. So we already did abduction, adduction, then flexion, extension, hyperextension, circumduction, inversion, internal rotation, external rotation, flexion, extension, hyperextension, rotation, internal rotation, external rotation, circumduction, internal, external rotation. So full range of motion of the hips, and then we're going to do your knees next. So flexion, extension, hyperextension, flexion, extension, hyperextension. And then we're going to do your spine. I'm going to have you lean forward for me. So this is flexion of the lumbar spine. Knee tenderness. Okay, you can stand up. And that was extension of the lumbar spine, and then lean back. And that's hyperextension, and then lateral. There you go, lateral flexion. And then, rotation. Okay, so her spine is midline and aligned without any tenderness or signs of scoliosis, and had an expected S curve there. And then that was our last range of motion. All the joints that we inspected today had full range of motion. We will now be inspecting your gait. I'm going to have you walk several steps towards the wall with a regular gait, and she has a symmetric stride length and regular gait. And coming back towards me, you're going to do walk that way in tandem gait, so it's heel to toe. And so she has consistent contact between her heel and toe, indicating correct tandem gait. Then I'm going to have you sit right back up here again one more time. We're going to do next a couple of further tests. We're going to do the light touch sensations. I'm going to close your eyes. And every time you feel me touch, just say here, 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 here. Okay, so light touch sensation is intact. Well, next to vibratory sensation. Tell me every time you feel vibration.
Now. 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 Now.
So vibratory sensation is intact. We will next assess her stereognosis. To do that, I'm going to have you close your eyes again, and I'm going to have you identify the object that I hand to you. Okay?
Paperclip.
All right, and that's, so she has stereognosis intact. Next, I will do grasthesia, and tell me the letter I draw on your palm.
1.
Okay, so that is correct. Next, we're going to do cerebral coordination. So we'll do finger to finger test, and then the next one, another hand. Okay, so then finger opposition, and then rapid alternating movement. So cellular coordination is intact. I'm next going to do deep tendon reflexes. And so I will have your arm, and then, okay, then that was brachioradialis, and then the biceps. Okay, and then the triceps. Okay, and then I'm going to do patellar reflex, deep tendon reflex. Okay, and then the Achilles. Okay, and then the Babinski's. So all of her deep tendon reflexes were intact. Last thing we have to do is we are going to hop on one leg and then the other leg, and then we will be done. So first your right leg, then your left leg, and then that's okay, and then that is it. That's so backwards. That's okay. Let's see how long that took. 23 minutes. Is that what I'm looking at? No. 20 minutes, 30 seconds. That could work.